The clavicle fracture is a common sports injury. This fracture is also the most common injury in a child during birth. Treatment usually involves immobilizing the corresponding arm with a brace or a sling.
Transverse fractures like these are caused by direct strikes to the leg, often auto accidents. Many of these fractures can be treated by casts, but some require surgical treatment with either rods or plates and screws.
The dislocated shoulder, this is very common sports injury, is treated by sedating the patient and manipulating the joint back into place. This injury, like any dislocation, must be treated immediately.
Compact bone is the dense, hard outer layer of a bone that provides strength and protection, forming the majority of the shaft of long bones and surrounding the bone marrow cavity. Spongy bone is a type of bone tissue that is lightweight and porous, with a honeycomb-like structure. Spongy bone is found in the ends of long bones. It's made up of small, needle-like pieces of bone called trabeculae. Haversian canals are microscopic tubes or tunnels in cortical bone that house nerve fibers and a few capillaries. Osteocytes are bone cells that are responsible for maintaining bone mass and regulating bone remodeling. Canaliculi are the narrow microscopic canals that are found in between the lacunae of the bone cells. The function of the canaliculi is to supply the nutrients to the bone cells, to remove the bone cell waste, and also aid in communication between the bone cells. Bone marrow is a spongy substance found in the center of the bones. It manufactures bone marrow stem cells and other substances, which in turn produce blood cells. Bone trabeculae are thin plates and columns of bone that form a spongy structure in cancellous bone. They are found in the ends of long bones, as well as in the pelvis, skull, ribs, and vertebrae. This is bone marrow. This is Haversian canal. This is spongy bone.
There are 4 types of bones. These include the short, long, flat, and irregular. On the proximal end of the femur, we have the trochanteric region, the femoral head, and the femoral neck. On the distal end of the femur, we have the intra-articular, the extra-articular, the condyles, and the shaft.